minutes.
Hello, what is your candidate number?
525.
Have you understood the Viva stem?
Yes.
Describe your management of the situation.
So this situation is basically a pre-op assessment of a elective cardiac surgery patient with ischemic heart disease and aortic stenosis who's got new shortness of breath. My differential diagnosis would be an acute coronary syndrome, a decompensation of his existing aortic stenosis or perhaps new heart failure. My management of this situation is to simultaneously assess and resuscitate the patient. I would I would speak to the patient to see whether this is a new phenomenon or not. It may be that he's just walked up the stairs and is short of breath, and he would normally be short of breath in such a scenario. I would focus my history on establishing whether the symptoms are new and unusual, and whether there's been a deterioration in his condition. I would examine him looking for signs of heart failure, for the severity of his stenosis, and looking for signs of cardiac compromise, so looking at his blood pressure, at his heart rate, looking at his oxygen saturation and his respiratory rate.
Okay, so you mentioned a couple of differentials, acute coronary syndrome and heart failure. Are there any other differentials?
Other differentials could be other unrelated things. So he could have a lower respiratory tract infection. He may well have a pulmonary embolus, and he may, given that he's got ischemic heart disease, he may be a smoker, he may have infective exacerbation of underlying chronic obstructive airways disease.
Okay, and what after your history and examination, what else would you like to do now?
I'd like to review his notes. So in particular, I want to know what his most recent echocardiogram shows. I'd like to know, so the nurse is going off to do an ECG. I'd like to know what the ECG shows.
What features would you be looking for on the ECG?
So on the ECG, I'd be looking for, and I'd like to compare it with an old ECG, but I'd be looking for any ST changes, any changes in the morphology of the QRS complex. I'd be looking for any ECG evidence of a pulmonary embolus, so S1Q3T3.
Okay, any other investigations to help with your differential?
So we've talked about the echo. I'd like to know what his respiratory function test shows. I'd like to know if he's had a recent blood gas on room air. I'd like to know...
So he's short of breath now in front of you. Are there any other investigations you'd like to do for a patient who's short of breath?
Who's short of breath?
Yes.
In front of me, I'd like to know, get a chest X-ray organised.
What would you be looking for on the chest X-ray?
So I'd be looking for any collapse consolidation, which would be consistent with a lower respiratory tract infection. I'd be looking for any cardiomegaly, which would be consistent with heart failure. I'd be looking for any other signs of heart failure as well in the lung fields.
So the nurse brings you the ECG and it shows ST elevation in B2 and B3 and ST depression in 2, 3 and AVF. What do you do now? So
the first thing that I would do is I would ring the cardiac surgeon who is supposed to be operating on this man. I would inform him that this man is having an acute coronary syndrome as we speak. I would be speaking with the cardiac team to see if it's possible to organise for the surgery to go ahead this evening in an emergency situation rather than electively tomorrow. I would also speak to the cardiology team to see to mobilise them in case if cardiac surgery is not possible tonight, to see whether there's any other endovascular procedure that might be suitable.
Okay, so the cardiac surgeon is going to come in and see the patient. And what would you do for the patient now?
So we've established that the patient has an acute coronary syndrome. What would I do for the patient now? I would stabilise the patient. I would start prepping the patient for surgery. I would obtain large IV access. I would insert